inspiration, we have the diaphragm, the external intercostal muscle, and the intercondral part, the internal intercostal muscles of the contralateral side. For deep inspiration, we have the erector spinae, scalene muscles, and the pectoral muscles. Expiration is a passive process. Forced expiration is done by the muscles of the anterior abdominal wall. Right? So this is inspiration of breathing in, caused by the diaphragm. Exhalation, then breathe out. Okay. So inspiration principally by the diaphragm, in which the sternum is pushed outwards and the space gets created inside the lungs, and there is breathing in through the nostrils. Now, like I mentioned before, inspiration, first is quiet inspiration, in which the anterior posterior diameter of the thorax is increased by elevation of second to sixth ribs, and the first rib remains fixed. The transverse diameter is increased by the elevation of 7th to 10th rib, and the vertical diameter is increased by the descent of the diaphragm. In deep inspiration, the first rib is elevated directly by the scaleni, indirectly by the sternocleidomastoid muscle, the concavity of the thoracic spine introduced by the erector spinae muscles. Forced inspiration, all the movements are exaggerated. Now, the scapula is elevated and fixed by the trapezius, the levator scapulae and the rhomboid, so that the pectoralis anterior and the pectoralis minor muscles may act on the ribs, and the action of the erector spinae is appreciably increased in forced expiration. In forced inspiration, Now, expiration, quiet expiration is done by the elastic recoil of the chest wall and the pulmonary alveoli, and partly by the tone of the abdominal muscles. Now, the deep and forced expiration is brought about by strong contraction of the abdominal muscles and that of the latissimus dorsi. Now, if the patient is experiencing dyspnea or difficulty in breathing, they are most comfortable while sitting up, leaning forward and fixing the arms. Fixation of the arms fixes the scapulae so that the serratus anterior and the pectoralis minor may act on the ribs for a good advantage. The height of the diaphragm in thorax is variable according to the position of the body and tone of the abdominal muscles. In the sitting posture, the position of the diaphragm is the lowest, allowing maximum ventilation. The diaphragm is midway in position while standing, but the patient is too ill or exhausted to stand. It is highest in lying down position, lying supine, so that the patient is extremely uncomfortable and he needs to put immense work for inspiration. Now, the most prominent role in inspiration is played by the diaphragm. The respiration is happening in two phases: inspiration, active phase 1, second, and expiration, passive phase of 3 seconds. In women of advanced pregnancy, descent of diaphragm, the diaphragm is limited, as you can see, so that the respiration is mainly thoracic. In young children up to 2 years of age, the thoracic cavity is only circular in cross section, so the scope of anterior posterior or side to side expansion is limited, and in the child the respiration is basically abdominal. Thank you.